sticking a burn. Just my fingers.
Another half
Feeling
of
your
25.
A few times over the past year, Estelle Huntman felt intense pressure in her chest. Pressure she assumed would just go away.
And then one day I happened to have in front of my sister, and she had a heart transplant, and she got really scared.
That prompted Estelle to seek medical care at North Colorado Medical Center, where it was determined she needed a cardiac catheterization. Doctors here are doing that procedure a little differently, accessing Estelle's heart through her arm.
The radial artery is easily accessible. There is less risk of bleeding, which can be a complication of using the femoral or the groin access. And then comfort for the patient.
For the past few decades, doctors inserted the catheter into an artery in the groin. Now, doctors say starting from the wrist is a better way to go.
The bleeding is a factor.
Dr. Beckman says bleeding is a risk when the procedure is done through the leg. Also, patients must stay on their back for several hours afterward.
We do have to hold pressure for about 20 to 30 minutes when we pull the sheath out of the groin. So there's some discomfort to the patient with that.
When done through the wrist, bleeding is uncommon. Patients are able to get up and go home sooner.
So same-day discharge as opposed to staying overnight.
Last year, North Colorado Medical Center performed more than 1,000 heart catheterization procedures. 18% of them were accessed through the wrist. That number's growing, bringing more comfort to patients.
So, I mean, you have improved outcomes, patient comfort, reduced costs. I mean, everything that you're going to look at on why should I be doing this.
Estelle received good news, no blockages in her heart. The next step in her recovery is to watch her diet and exercise.
This afternoon, he said I should be able to go home, and I'll just take it pretty easy today.
For Banner Health, I'm Paul Matthews.